Good morning, good evening, I should say, everyone. This is Reverend Gerald, and welcome to our last edition of the 2022-2023 Black Wealth Attainment and Retention Program. These BWARP workshops featured qualified and concerned financial and well-being experts that educate and inspire us to attain, retain, and grow and pass down legacy wealth. We started this series to help close the wealth gap between white and Black households and help fulfill LA's desire to build a Black Wall Street here in Los Angeles. That was the dream of Michael Lawson, LA Urban League's president. And Parkside Economic Development Community is here and has been around for 20 years to enhance financial literacy in our community and provide post-secondary education to the young people in our community. I want to thank our partner, the Los Angeles Urban League, for their commitment and tremendous support for BWARP. Tonight, we bring you The Wealthy Mind and Body. You know, Dennis Waitley, the author of The Psychology of Winning, said this: like money, time and wealth are two precious assets that we don't recognize and appreciate until they've been deleted. So during this presentation, you're going to have questions, and we'd like you to put those in the chat or the Q&A, and our virtual producer, Jacinda Moten, will make sure you get an answer during our Q&A portion of the program. Our presenters this evening are Dr. Rick Williamson and Dr. Derek Williams. I believe that mental health is the biggest problem we have in this nation. So starting off this evening is Rick Williamson, PhD, Executive Director of the Amada Institute of Behavioral Health and Wellness here in Westchester. Dr. Williamson is committed to understanding the whole person and brings a deep understanding of how life situations, culture, and beliefs impact a person's psyche and their well-being. Dr. Williamson earned his BA from Princeton University and an MA in theology and a PhD in clinical psychology from the Fuller Graduate School of Psychology. He performed his clinical psychology internship at Howard University and APA postdoctoral research fellowship at UCLA. Dr. Williamson, we appreciate you being here with us tonight and sharing your presentation on the wealthy mind and body.
Thank you, Reverend Gerald. Delighted to be here with everyone. If you give me a moment, I will pull up some slides that I will share with us. Wonderful. And let's make sure that give me a thumbs up if you see the slide, just so I know we're good. Thank you very much, Jacinda. All right. Well, everybody, welcome. My name is Rick Williamson, like Reverend Gerald mentioned. I'm a clinical psychologist by training, and the work that I do primarily is obviously the type of therapy that you would think of, but in particular, my specialty is I actually study what makes people thrive. The nature of the work that I do takes me all around the globe. I work in communities that are dealing with large systemic challenges, oppressive dynamics, discrimination all across the globe. And basically what our research has found is we find the people who are most resilient, the people who are actually strong individuals, in contexts where they actually have to deal with adversity. You know, the catch-22 of our research is we want everyone to be strong, but we're only finding that strength with people who have actually dealt with adversity and challenge. But most adversity and challenge does not actually come to make you strong, it comes to crush people. So how do we actually transform that into strength? And so a lot of the research that I do is highly applicable to the Black community in particular, given the particular historical context that the community has dealt with. So I'll be speaking to you from everything that I know and bringing that to this topic that we'll deal with today. So to start off with, let me just say it this way. When we find people who are actually thriving in the midst of life's difficulties and challenges, people who can transform that into goal attainment, into the things that they actually want to see in life, what we're actually finding is people who are actually engaging in particularly healthy life routines. And this is what's distinguishing them from people who actually are burning out, people who have the most difficulty attaining their goals, navigating life, navigating the context of work. It is the life routines that they engage in, but these particular routines pertain to particular areas of life. And so if you wanted to get a sense for how important that is, those healthy life routines ultimately allow people to have what we call optimal brain health. Your brain is the thing that helps you to attain your goals, deal with whatever the situations that come along with that befall you. And if you've got a healthy brain, if you've got a brain that works with you and not against you, you have a better chance of actually navigating those situations successfully. I always say this though, there is no situation that is so bad that we'll ever face that it cannot be made worse. I'll say that one more time. There's no situation so bad that we'll ever face that it cannot be made worse. And the things that will make a bad situation worse is if we become very impulsive, or if we become highly reactive in the situation. And the people who do not engage in healthy life routines, they are the people who are most susceptible to becoming highly reactive, highly impulsive in how they're responding to life. And any good goal, any good thing can actually be brought down and ruined by that type of a response, by that type of a pattern in life. So we're trying to help people transform into the type of health and brain health where they can actually navigate life much more effectively. And so with that, this graph that I have put up is what I want you to remember. If you don't remember anything else in terms of what I might put on the screen, this is the one I hope you come away with. This is what we call a stress curve. So we are looking at how people function, which is what is on that horizontal line, according to how much demand or responsibility or stress they actually endure. So the more stress you have, the further along to the right you go along that horizontal axis. But how you respond to that stress, that is your y-axis there, the vertical axis. Pretty much when people deal with demands and stress, they rise to the occasion to resolve it, to deal effectively with it. That's why you see that curve going up as you actually get more stress. But ultimately, there is a point beyond which if you just have too much stress, too much demand, you don't have limitless time, attention, or energy to deal with all of that. You cannot deal with a million things. And so you hit that X, which is at the top there, and that's the place where you will get into overload if you add any more to your plate. And when you add any more to your plate, your performance, the way that you handle life on life's terms, starts to take a decline. Now we start to see a decrease. And ultimately, people can get to the place on zone 4 there in the red, where they're actually experiencing all of the stress, the anxiety, the panic, the anger, and ultimately the breakdown and the burnout. What we are trying to do, we are trying to get everybody rooted to zone 2. The zone 2 that you actually see here, that's the zone that's associated with people who are actually thriving, even in the midst of life difficulties and circumstances that are actually challenging. They still thrive because they actually have good brain health. They can engage situations successfully, and they have the best chance of overcoming situations, even if those situations are quite difficult. The challenge is, how do we get people from zone 4, zone 3 into zone 2? So here's a bit of a self-assessment that I'm going to ask everybody to do as I go through this. I'm going to describe what each zone actually feels like. And I do want you to put yourself somewhere along this curve in one of these zones based on how you think you've been actually experiencing and navigating life over the past 2 months. So just consider the past 2 months, everything that's on your plate, all your responsibilities, and place yourself in one of these zones as I described them. In zone 1, this is the zone that, even though it's green, it's not ideal. It actually is the zone that's associated with people feeling bored or disconnected from life. They feel like there's not enough for them to do. They feel like, they've got energy and drive, but they've got nothing to expend it on. So these are people who have too little engagement in life. And so most people tell me that I wish I had that problem, but it is a problem if you do have it. Okay, so that's not a great zone to be in. It's too little engagement. Zone 2, we call this the optimal zone. This is when people feel like they're really engaged in life, they're engaged in their projects and their works, but they actually have a little bit of cushion left. So they feel like they might operate at about 80, 85%, 90%, and they have maybe 10, 15% cushion so that if anything happens to get put on their plate in addition to all that they have, they feel like they can take it on and handle it just fine. So that's zone 2. Zone 3, these are folks who feel like they're handling everything they have on their plate, but heaven forbid if they get anything else put on their plate. They feel like they're up to their eyeballs already. They don't need anything more. They recognize they're at their full capacity and can't take on any more. Zone 4, these are the folks who realize life would feel a lot better if they had less on their plate. If they could just delegate it, if somebody could take some things off, things would be a lot better for them. They do feel that stress and that anxiety. That's zone 4. Place yourself somewhere in these on this curve, zone 1, 2, 3, or 4. And if you don't mind, go ahead and put it in the chat if you don't mind. If you feel like you're zone 4, let me just give you some comfort. Many people are in zone 4, especially these days post-pandemic and all the changes that we've navigated. So please don't feel like you're the only one. Okay? But I want everybody to get a sense for, number 1, you're not alone wherever you place yourself. Number 2, where we're going is how do you actually get people into zone 2 where things are optimal in terms of how you then navigate life, how you then approach your goals no matter what those goals are, and you have the best chance of attaining them. To include financial goals, to include the things that you really have your sights set on. Now, let me give you a little bit of a warning with this. If you've placed yourself in zone 1 or zone 4, most of the time, these are the people who are absolutely accurate in terms of their self-assessment. If you've placed yourself in zone 1 or zone 4, you're actually accurate in your self-assessment. And I do see a lot of zone 4s and 3s and some 2s, but I see the 2.5. I got you, somebody. Zone 4 and zone 1 accurate because you feel that. You feel the overload or you feel the disengagement. The challenge is people who place themselves in zone 2 and zone 3. In zone 2, you don't feel stress. In zone 3, you may not actually feel the stress either. You may not actually feel, you're just beginning to feel that stuff. And so I always say the challenge is this. If you think you're in zone 2 or zone 3 is you're handling everything on your plate just fine, you just don't need any more. The people who do life with you, the ones who live with you, the ones who work closely with you, you must ask them, hey, I think I'm handling everything on my plate just fine. What do you think? Because those are the people who actually can recognize if you are in zone 3 and you're beyond your capacity. If you notice on this graph, that dotted line across the top, that is a line that says when we enter into zone 3, we get into overload, we are beyond our capacity, we don't realize it. We think that we're responding optimally at that dotted line, but what's actually happening is our performance is taking a decline. But the people who see it is not the person who's on the decline until they get to zone 4 when they feel it. The people who see it in zone 3 are the people who work closely with us and do life with us because we're making little errors that we don't catch that they have to pick up behind us. Our tolerance is getting short, so now they got to walk on eggshells around us, how they engage us. They got to be real careful not to set us off. We don't see it, but the people around us do. So when you ask them, I think I'm handling everything just fine, but you're actually in zone 3, notice if they hesitate and pause in their response to you. If they don't say yes right away, just know they might be trying to give you some information without setting you off because you might actually be in zone 3 and they're tiptoeing around trying to avoid the landmines so that you can receive the information. So that's a really good confirmation in terms of if you've placed yourself in zone 2 or zone 3 to really determine if you are. The people who do life with you, what do they actually say? A real important piece there. But the goal is how do we get everybody to zone 2? And that's the nature of the work that I do. And let me just say very quickly, you can get into zone 2 easily by getting rid of the things off of your plate. Most people don't really feel like they can do that very easily for a number of reasons. So I always then say, well, then if you don't get rid of the things that are on your plate because you cannot, then you have to actually engage life in such a way where you become very effective in how you deal with life. So even if you have 100 things on your plate, you can still manage it so efficiently that you regain some cushion, and now you're back in zone 2. And the goal is to stay there, not to actually take on more because you can. And you need that cushion because life will throw the curveballs. If anything has taught us that, it's the past several years. Pandemic, racial upheaval, look at the economic situation that we are in currently. All of these things are unexpected, and that's at the macro level. But your life itself, your children get sick, your partners and spouses, they don't act right sometimes. All of these things are the things that life will throw. Your car will break down, okay, when you're trying to get to the job or when you're trying to get to the important place. And it's designed to do so. So believe me, the auto industry, they can make a car that lasts 50 years, but there'd be no auto industry. So these are the things that we just know are the expected unexpecteds that happen. Therefore, you need the cushion to be able to deal with those. And if you operate at the X and you operate and stay in zone 3, you have no cushion. When life's curveballs happen, you have no place to go but down. And when down happens, your brain starts to function against you, not with you. And that is what we're about to get into. How do we recognize that? If you're in zone 4, it's easy. You feel it. But if you're in zone 3, you may not see it. And I'm going to give you some tips in terms of how you can actually then recognize when you're in zone 3. These are the signs of zone 3. And I do want you to recognize that if you have 1 or 2 of these, you may actually be in zone 3. If you have none of them, you are probably in zone 2, optimal. But if you've got 4, 5, then you're in zone 4, and your brain is actually working in such a way where we've got to get you out of that. But here's the first signs that I'd ask you to consider. Why people don't recognize when they're in that overload state before they're too stressed is because they miss these symptoms. When you're in overload, your body's going through changes. One of the first signs is sleep issues, particularly difficulty falling asleep, early insomnia. If it takes you longer than 20 minutes to fall asleep at night, a lot of times for many people it's because they've got elevated stress hormones in their system from the day because they've got too much overload happening. And a lot of these stressors that we deal with, we would think, oh, I would recognize if I've got a lot going on, but sometimes the stressors are just in the environment every day and we don't realize it because it's there all around us all the time. We don't feel it as stressful, but it's actually working on our system in a negative way. So I always tell folks the story of the fish. You know, the fish who are swimming through the water, and they're excited about all the activities they're about to partake in of the day. And when they pass the larger fish asks them, "Hey, fellas, how's the water?" Nothing more is said. They swim on. But after a while, one of the other fish turns to the rest and they say, "Hey, that old fellow, he asked us how was the water. What is water?" And none of the other fish knew. And the point that I'm making with that is there are some things in your environment, they're around you all the time. You eat, sleep, and breathe it so much and so often that you habituate to it. You stop feeling it and recognizing it. It's the water in which the fish swim, and the fish don't recognize the water. That's the nature of some of the stressors that we actually deal with that can cause these issues. So it's really important to be able to recognize the first signs of these things because that lets us know we're dealing with an environment often that has stressors that are actually designed to tear us down. The first sign, sleep issues. Second sign, people become prone to conflict or they start to withdraw socially. And really what this is about is your tolerance for frustration, your tolerance for things that you normally can tolerate. They're not fun. Your tolerance shrinks. So now things that you used to tolerate now start to annoy you much more. You start to become much more reactive to these things. And always warn folks, be careful when you have this because oftentimes people don't recognize the issue is your tolerance has shrank. They often think, no, it's the people I'm dealing with who've become worse. That's how they miss it. That's how they don't recognize they're in a zone 3. They think that it's the outside world getting worse, but in actuality, the outside world is the same. It's their tolerance for it that has decreased. Now they're becoming much more reactive to it. And so this is where I say, hey, the person who you do life with, they're not any worse. Your job's not any worse. They're all the same. This might be what your mother warned you about when you got with this person, and now you're seeing it because your tolerance has changed. So don't quit a relationship or leave a job out of this state because that's reactive. You'll do that, your tolerance returns to normal, and then you regret it. You get out of this, and then you make the decisions from a non-reactive place. These are the types of habits that are helpful. A feeling of no room inside, everything affects us. What we mean by this is when your brain is going through changes due to chronic ongoing stresses that you may not recognize and see. Your brain starts to do things like having real inability to stop you from becoming reactive so that everything starts to affect you. Everything starts to elicit emotions. So here's an example. A good movie, I hope it produces tears at the sad times. That's fooling your brain into an experience, and good movies get an Oscar for that. But when you have this a symptom, these are people who are actually crying at commercials, things that are not meant to elicit emotion. They're actually having all these emotional reactions, right? So if you're having a tearful response to the cereal commercial on TV, and this is exactly what people tell me when they have these symptoms, you feel like you're out of control of your emotions, and that's one of the signs. Being unable to think well, that means when you're naturally dealing with life and life's goals, there's a part of your brain that automatically prioritizes, well, what are the important things to attend to and respond to? Your brain works with you in that capacity. But under too much stress over time, your brain starts to work against you. And then what happens is your brain cannot prioritize easily. And so I call these people the folks who are rearranging the deck chairs on the Titanic. And what that means is, hey, there's a real situation or issue that needs to be addressed, but rather than doing something that's helpful, they're doing something and they don't realize that it's not so helpful. It's hard to recognize if this is you, but if it is you, here's how you know it. If you get the question, what do you want to eat for dinner? Where do you want to go this weekend? And you cannot make up your mind, and you're normally a decisive person, but for some reason you're hung up on the fence with normal, simple questions, that's this symptom. Your brain is not working with you anymore. It now becomes much more effortful to do just simple things. Be careful of instant gratification, coping, things that are instant gratification. You take it, you smoke it, you engage it, you feel better quickly. Alcohol, tobacco, drugs, sex. So these are the things that when you're under pressure and stress, be careful of engaging these things because they actually create habits of addiction, but it creates these habits of the next time we deal with stress and challenge, we want to go for instant gratification so that we feel better, as opposed to do something constructive that helps us move through the process and actually resolve it. And intrusive thoughts. We all have these moments where we have so much on our plate that we cannot focus on the thing before us, and our whole day is spent wrestling our own thoughts and attention back to the task that we're trying to do. That's what we're talking about, intrusive thoughts. And the final one, memory problems. And I'm not talking about you forget your name, okay? But I am talking about if you leave the house and you can't remember if you locked the door. If you're looking for the keys to the car, you can't find them, and after 5 minutes, you realize they're in your hand the whole time. Short-term memory issues, if you start to have too many lapses there, many people think, oh no, I have early Alzheimer's, is this the end? And in all honesty, 9 times out of 10, it's not. It's just a sign of stress and being in zone 3, because the part of your brain that's responsible for memories is highly affected by stress hormones over time. These are the symptoms. If you've got none of these over the past couple months, you are in zone 2. But if you've got 1 or 2 of these, maybe 3, you're in zone 3. But if you've got 4 or more, I can guarantee you're in zone 4 and you probably recognize it. So finally, how do we then get out of zone 3 and zone 4 so that our brain works with us, we can take on life and engage things in a way where we can then overcome them and thrive? Resilience. These are the life patterns and habits that the people who thrive, even in difficult contexts, they have these habits. It involves how you actually take care of yourself physically. And I will leave this primarily to the good doc who's coming behind to actually talk about that. But to give you a good sense of that, people who have an exercise regimen of 3 or 4 days a week, they get their heart rate up because they've got some cardiovascular workout going. Those are the folks who lower cortisol in their system. Cortisol is a stress hormone. And when you actually can lower it, that is what protects the brain from all of the stress impact that actually causes it to respond with impulsivity. And so that's the part of the brain that you can also repair if you just engage an exercise regimen with consistency. So if you get a cardiovascular workout going 20 minutes at a time in duration, so you do have to keep it going for 20 minutes straight without taking a break, you get that heart rate up, get some sweat going, that produces a protein in the body that repairs the brain in a way where it starts to function optimally again. And this is how we get people into zone 2 when they've got all those symptoms I've talked about. Social support, excuse me, that's my time. So let me get, social support is sort of the bang for the buck though. If you don't have anything else, if you have good people around you that you connect with and stay connected, you're going to live a long time and be okay. And so an example of this, people who've got good folks in their job who they can connect to and relate to, who understand how to sort of come alongside you in the best ways that you find helpful, stay connected there. But you need people who also are good people outside of the job. Friends and family who know how to connect and relate to you, that's the bang for the buck. And I always give my wife as the example, if you don't mind on this one. She's a therapist similar to me. And when she's got a bad day, she comes home and she wants to talk through her bad day. My job at that point is to listen. But I also have this habit of trying to fix things. And so as she talks, if I get into that fix it habit, hey, have you thought about maybe doing this instead? Because I'm a therapist too. She'll get upset. I'll see the look on her face. She doesn't appreciate it. She'll stop talking to me. She'll cut me off. And she will get on the phone with her best friend. They both moved out here from Chicago together. They've known each other since middle school. And they have a conversation. In that conversation, I cannot understand because they both talk at the same time. They just don't introduce a topic. They know exactly what each other is saying. They can switch a topic and nobody's introduced a new topic, but yet they're in lockstep. And when my wife gets off that call, she looks 20 years younger. She looks refreshed. And that's what it takes because she's no longer a frustrated therapist. She's no longer a frustrated spouse. I did that. She's now the best friend again. So if you've got people in your life who know you well enough, who can actually engage you and pull you into the best friend mode or the niece or the auntie mode so that you're out of those other modes, that's the channel change for your brain that'll keep you healthy. That's what's helpful. That offsets the stress impact on the brain because it produces a type of chemical in the body that offsets the stress effects of cortisol. That's what's happening with that. Self-efficacy is just how do you actually engage life in your work. And if you've got the competence and the skills to work well, then you need the confidence to know that you have those skills. So it consists of the competence and the confidence. The confidence is important because when you face unusual situations, people who thrive start to focus on, well, what do I know in terms of how do I need to navigate life? Because if you stay focused on the unknown that's out there that you've never seen, that makes you more anxious. You shift your focus to what is it that you do know. You've got skills, you know how to do life in particular ways. You may pray, you may do a lot of things, but you shift it to what is it that you know. That's a small shift, but it's an important difference between people who thrive in unusual situations and people who do not. And finally, meaning and purpose in life. Ultimately, life can dish out some stuff. And healthy communities actually can help mitigate the effects of that. But ultimately, there are just some real difficult situations in life that have our number. And when we encounter those, how do we make it through? And people in the Black community have a long history and legacy of these frames that help us with faith, with spirituality, that help us to engage life in such a way where we're trying to then grapple with why do these things happen? We may not necessarily get the answer, but we still stay engaged in such a way where we're trying to basically, in the words of Martin Luther King, keep in mind that the arc universe can be long, but it bends towards justice. Therefore, lies don't live forever. And that's how we can continue to strive forward, even in the face of oppression and adversity that can last 150 years, 200, 300 years. This is the same thing that we need today. The oppressive dynamics are still there. They may manifest differently. But when we've got these frames that are helpful frames, we stay engaged with these routines, whether they be faith, Sabbath, religious life. These are the things that help us through the worst situations, even if they don't necessarily give us the answers to life. We just stay engaged within a way that prevents the trauma from actually forming and setting in. And so I'll leave you with these things, and I look forward to the Q&A because we can definitely, get very practical with it. That really is my job, how we put these into actual practice to develop the routines that ultimately lead to people thriving. And I really enjoy and looking forward to doing that. So with that, I'll stop and pass this back over to Reverend Gerald. Take it away, sir.
Thank you so much for that. I know you helped me with my number 3 self. So I really appreciate that presentation. And I know if the rest of you feel as I do, you're going to have a lot of questions. for Dr. Williamson. So please put those questions in the chat or Q&A. And during our Q&A period, Jacinda will make sure you get answers to all those questions. Our next presenter is going to tie a healthy bow around tonight's presentation. He's Dr. Derek F. Williams, board certified family medicine specialist at Providence Healthcare in Hawthorne. Dr. Williams brings years of experience addressing the health concerns of adolescents, women, men, and the often complex issues of aging. He values the whole person, body, mind, and spirit, and empowers his patients through personal wellness and preventive lifestyles. Dr. Williams graduated from the University of Missouri Medical School and completed his residency fellowship at the University of Kansas Medical Center. Dr. Williams, thank you for sharing with us this evening. I can't wait to hear what you have to say.
Really appreciate you invite me. And the LA Urban League is, well, the Urban League in general. My dad was actually part of the St. Louis Urban League when I was a kid growing up. So this is a legacy that goes way back in my history. So it's an honor to be here, and excellent presentation. I think you couldn't have picked the two topics that mesh any better together. So well done. So let me get my slides going here, and then we'll get right to it. All right, let me know if you can see that. All right, excellent. So I will jump right into it. You know, health and wellness to me is really important. I really like the idea of connecting it to wealth, because a lot of people understand wealth, but not as much health. So, you know, you think about you know, health being not just your body, just like a piggy bank is not your wealth. You can put coins in a piggy bank and take them out, but that doesn't generate wealth. And if you take the same simple approach to your health, you're definitely not going to have wellness. So we'll talk a little bit about a framework of thinking about this that I've developed over the years of practicing and caring for patients. And let's start with something I do that's a little unusual. So many of my patients, young Black men or young folks in general, I'll actually pull out my cell phone and actually pull up this compound interest calculator. So say you have person A, person A and B both start with $1,000. And person A decides to keep spending $10 a day on coffee, fast food, eating out. Person B says, you know what, I'm going to save that $10 a day. I'm going to bag my lunches, fix my coffee at home. I'm going to be frugal. And so after 40 years of this, at an average interest rate of 7%, person A enjoyed their $300 per month, saved none of it, and that $1,000 grew to $15,000. That seems pretty impressive, right? But person B saved that extra $300 a month, and that $1,000 grew to $733,660. And so I love when people are not familiar with compound interest, I love to see the shocked look on their faces about how little it takes consistently over time to make a big impact. So, you know, many of us may not have, I'm not sure, Lord willing, I do have that long of a timeline, but many of us don't. But this example just shows how important it is to commit to repeating simple things over time to accumulate wealth. And then if you think about sports, think about your favorite basketball star, football player, marathon runner, any sports you can think of. So none of these people started as a professional athlete. Can you imagine what Michael Jordan looked like slobbering in his crib, or pick your favorite athlete. Their greatness wasn't built because they popped out of the womb with a basketball in their hand or football in their hand or track shoes on. It really was built on simple skills repeated consistently over time and mastered. And, you know, we're not all going to become athletes using this approach, but everyone can improve using this approach. And, we consider this a lifelong process. A superstar basketball player doesn't arrive and have to stop going to practice. So it's something they maintain over a lifespan. So compound interest works with money, as I showed, in sports and any skill, but it also works in health and wellness. So think about the doctor's office. You go into the doctor's office with your body. You're concerned about your health. You're concerned enough to go to the doctor's office. Many people don't even go. So if you're really concerned, you want to learn about it. You want to protect it. You want to cultivate it. You want to nourish it. And just like Dr. Williamson was talking about, there are things you can do to optimize your brain function, your body's function. And we should learn that. We should become students of it. Now, this is the tricky part. So I went to school a lot of years. A lot of people would say a physician is an expert, a PhD psychologist is an expert. So as doctors, we're definitely problem solvers. You come with a medical issue and we kind of help you work through that. But you also want to think of us as your paid consultant. We're kind of like your health and wellness coach. We've studied this intently for decades, years of experience, years of study, all to the purpose of serving you during that doctor's office visit. So what you want to make sure you do is when you walk in there, think of leaving the appointment with some very specific plans that you're going to act on. I mean, you wouldn't go to a financial consultant, complain all the way there, question the expertise of the consultant while you're there, and not do anything that the consultant told you when you leave. And so the same thing is true when you go to the doctor's office. You don't want to waste your time. You really want to utilize that highly skilled expert for your health benefit. One other thing I wanted to talk about, this is a little bit off the beaten path, but when you're thinking about managing your health, it's really about managing risk. And this is something I'll draw this out for patients because they're saying, well, why would I take a treatment when treatment has risk? Every medicine I use, every surgery I recommend, every intervention does have some level of risk. And so patients say, well, why would I have to take it? Well, because it's not about the treatment risk, it's about the risk of not treating the condition. So if you have diabetes or hypertension or heart disease, not treating it has a substantial risk that can be reduced by the appropriate treatment. And so if the risk of the condition is equal to the treatment, well, you don't necessarily have to take the treatment, but when there's a significant difference between the two, the treatment is a reasonable option to reduce your risk. So just something I wanted to add in there, because I think it's really important for folks to understand when they go to the doctor's office, the doctor is your paid consultant, your expert who should be answering your questions and also helping you understand how you're managing your personal risk. Okay, so health is definitely much more than your body. A lot of people come to the office and they have sort of a one-dimensional view of their health. And Dr. Williamson was alluding to the many facets of how we respond to stress. And the same is true when you think about the body. So yeah, we do have a physical body, but we also have mental capacity. So what we think and how we process information. We also have emotions, and we also have a spirit. So when I see patients, when a patient walks in with a physical complaint, every single patient I see also has mental concerns, things that weigh on their mind. They have past traumas that affect how they process information and act on information. There's emotional weights that we carry. And these are all under the surface. I mean, they're coming in for hypertension, but their life is maybe in zone 3 or zone 4. So you have to be able to see that holistically to treat a condition properly. And the other thing to think about is all these domains affect each other. So the mind and the body and the emotions and the spirit are not separate in separate boxes. They're actually one thing that's tightly woven together, and they all interact with each other. So in order to attain, so getting healthy and well, sustain, so you're keeping it, and passing on a legacy of health and wellness, you just need to be mindful of each of these domains, body, mind, emotions, and spirit, and recognize that how this affects each of the other domains. So When one suffers, the others will suffer. So if you have pain in your body, you will also, and you felt this before, when you get sick, so if someone got, God forbid, if you got COVID and you got very sick, yeah, you were sick in your body, but you also felt emotionally maybe depressed, maybe drained, maybe hopeless. It maybe made you think and process things differently. Maybe you were pessimistic as opposed to your normal optimistic personality because of what was happening in your body. And so when one area, one domain suffers, the others will suffer, and it affects the others. But the cool thing about it is that can be turned around to your benefit. So whenever we're treating the body, we don't just address the body domain, we address all the other domains as well, because they can impact how well you manage your diabetes, how well you manage your high blood pressure, how you manage your heart disease. Yes, we will put you on medicine to lower your cholesterol, control your sugar, control your blood pressure. But I will also discuss with you how you're doing emotionally, how you're doing with processing and learning about the disease that you have. And also if you have a connection to sort of that greater meaning in life, because as Dr. Williamson mentioned, life will take a detour and will lead you into a dark place that if you don't have that existential view of things, it makes it very difficult to traverse. Okay, so here we can pause a little bit, but I don't want to go into each one of these. Each one of these is an evidence-based recommendation. So on the left side, you have positive, healthy lifestyles. On the right side, you have the things we all love to do. So you've got your junk food and your fast food, and you've got your red meat and your fried food and sugary beverages, too much alcohol, inactive lifestyle, sitting too much and not exercising. Also think about mental things. So avoiding learning new things. Or emotional avoidance, or like you said, if you're overwhelmed emotionally, you're going to be less likely to process or manage successfully in the other domains. One quick comment about the stress excuse. So that's what I've named it, and I talk to my patients about this all the time. Is that stress is the catalyst for doing the things on the list on the right. We use the stress from our job, the stress from our lives as excuses to do these things. And once you recognize that, you can press the pause button and realize that actually when stress increases, you really need to be more deliberate, intentional, and proactive about doing the things on the left side of the screen. So mostly plant-based diet. So I'm not a vegetarian. I was born in the Midwest, and I do eat meat and enjoy it. Sorry if that offends anyone, but you want to have as high a vegetable diet content as you can possibly have. Multiple different types of vegetables, different colors. Each one contains micronutrients that are beneficial for health. Plus, the more veggies you eat, the less you eat of things that are less healthy. So, but if you do eat meat, you're going to eat leaner cuts of meat, avoid red meat, and avoid fried meat. And then for hydration, you want to avoid things like sodas and juices. You want to have primarily water or no calorie containing beverages. I don't recommend sugar-free. There's some evidence that people who take a lot of sugar-free beverages in actually don't lose weight. And oftentimes you'll see someone ordering, say, a double quarter pounder with cheese meal and a Diet Coke, and that's not really an effective strategy for losing weight. And then cardio exercise. This is something people sometimes get wrong. People think you have to exercise so hard that you feel it. I think you need to exercise just enough so you can repeat it every day. And so if you're going to walk 30 minutes a day, you want to walk slow enough that you can do it tomorrow and the next day and the next day. As we age, our cardio capacity, our strength, our balance and flexibility will decay. So you want to actually have a lifelong approach to addressing cardio exercise, strength training, which can just be body weight exercises, floor exercises that you do at home, or you can go to a gym. or you like I showed earlier, you could save that $50 a month and build wealth while you're building your health. And then challenging the mind. So just like your body, your mind is kind of like a muscle. The more you challenge it with new ideas and input information and process things, and also interact with different people and circumstances, it keeps the mind sharp for a lifetime. People say, well, what do I do to keep my brain from losing capacity? Do I do Sudoku or crossword puzzles? You could do that, but you don't want to just be good at crossword puzzles. You want to have a variety of mental stimulation to keep the brain sharp. And emotional health, I think the last few years has really been, there have been a lot of amazing changes that the pandemic has brought and the social unrest that we've experienced. And I think this generation is much more willing to talk about and deal with emotional issues. The problem is we're also in an environment where there's not a lot of capacity on the treatment side. So there's not enough therapist capacity. There are not enough psychologists and psychiatrists and counselors available to do this work. And so it really behooves us to make sure we have a personally healthy approach to self-assessment, connection with others, and using those tools that we do have. Many of you may have a doctor who's willing to talk about these issues and be supportive. So definitely reach out if you can. And spiritual health, I think really thinking about existential issues, thinking about your why. That why is sort of the bedrock of what gets you through troublesome times. And so instead of stress excuses, you're into a proactive stress management mode. So, all right. So let's give you, this is a little depressing, but I wanted to share this. So doctors have a lot of work to do. And if we were to follow every single preventive guideline, and a preventive guideline is something that we recommend to you that reduces your risk for illness and death. And so it's very important. And also your chronic medical treatment is important. So your high blood pressure, your follow up with the cardiologist and things like that. So if we did all of those things, it's estimated that doctors would need 27 hours per day to address all of these issues for our patients. So what does that mean? That means you are required to participate in your health. I can't do it all. I can give you recommendations. I can give you the information, but the only way that we're going to close this gap is to make sure that you're actively engaged in protecting your health and actually supporting the doctor who's your advocate. So things like getting your colon cancer screening, your breast cancer screening, and your mammograms, your lung cancer screening if you're a former smoker, screening for infections like hepatitis C or hepatitis B or HIV or depression or a host of other ones. And if you want to learn more about some of the things that might pertain to you, you can go to the US Preventive Services Taskforce.org site, and you can search to your heart's content all the evidence-based guidelines that doctors may use to assess and recommend to you. And also includes things like vaccination. Okay.
Yeah.
So we talked earlier about sustaining health and wellness. Life is inevitably hard. I remember being a kid thinking all I need to do is get grown. And I realized once I got grown that this thing is a whole lot more complicated than I thought. And life happens as careful as we are and proactive as we are and skilled as we are, life still happens. And it brings us things that we would prefer not to have to go through. We want to make sure we develop a resilience to these healthy habits despite the ups and downs of life. So, marriage is a change, having kids is a change, changes in jobs or job-related stress or financial stress, ailing parents, personal medical issues, personal loss, even aging, past traumas. And, in a group this size, there are no doubt people who have gone through very, very difficult personal experiences. And and or even illnesses that have caught us at some point. So how do we come up with a program personally that helps us navigate these storms of life and still maintain these healthy habits? I can tell you that from personal experience, when I'm stressed, I start thinking about eating Doritos, or if my kids are listening, they're probably laughing because it's true. Or, there are a lot of different things that you think about when you're stressed, and instead of impulsively giving into it, that's actually kind of alarm. It's like a red flashing light that tells you might be stressed if you're thinking about fill in the blank. And the list was, it could be alcohol, it could be drugs, it could be sex, it could be risky behavior that gives you that rush that covers over the pain that you're going through, as opposed to taking a pause, recognizing that signal, and actually engaging in some healthy habits, whether it's healthy exercise, healthy eating, healthy connection. And it turns out that that's not only does the same, it reduces that pain, but it actually doesn't have a hangover at the end. So definitely something you want to think about, and definitely be able to recognize and avoid that stress excuse. So, okay, so when you go to the doctor's office, it's all about prevention and disease management. So when you're going to the doctor, I want you to be thinking about a few things. And again, you're going there with the mind to know what's going on and to leave with instructions. So you want to know what the disease is. You want to know what the risks of the disease are. Remember, this is about risk management. If you don't think there's any risk, then you're not going to follow any instructions because you don't feel like there's anything you need to avoid. Know your options. What are the treatment options? Do we have to take medicine? Are there things that I can do without taking medicine? If I take medicine, what are my medication options? Is it surgery? What type of surgery? So know why you're treating and how you're treating it. Also want you to think about what are the signs that things are good? So what blood tests, what imaging studies that'll show you're improving or declining. Finally, we underestimate how much lifestyle impacts disease in this country and around the world. And it's estimated that 50% of the diseases that we deal with are related to lifestyle. And so you think about diabetes, more than likely, half of the reason why someone is dealing with diabetes is either caused by or contributed by the lifestyle that they're engaging in. And then the other thing that's really key is you may not want to see the doctor, but when you have a condition, you want to know when and how often to follow up. So when's the next appointment? Never leave the doctor's office without a specific recommendation. When do I come back next? If you're young and healthy, okay, I'll see you next year. But if there's some condition or we're monitoring one of your blood tests, definitely want you to follow up with a certain frequency. I may say 3 months or 4 months or 6 months. And you'll understand why that is because you will know the disease, the risks, and why you need to follow up to monitor the progress. So what's this look like? So this is a good example. This is exactly applying that previous slide into a real world situation. So let's take diabetes. So you're going to know what the disease is. Well, what is diabetes? It's elevated sugar. And when your sugars are high, then that affects your body in how many different ways? Well, what does that do? What's the risk of diabetes? It's strokes and heart attacks and blindness and kidney failure, nerve damage, amputations. And those are bad. And so once you understand what diabetes is and what the risks are, then you can really understand what you're treating. What is the purpose of treating it? Well, you're trying to avoid these things. I don't want to have a stroke or go blind or lose my ability to be independent because I've lost a limb or something. So understanding the risk helps me engage earlier in the process to do some of those things that will help avoid those things later. Knowing how you're going to treat it. So in this case, medications, there are pills, there are insulins, there's new injectable medications. So knowing what those are and why you're going to choose them in what order. And also probably the most important thing, because this is something each of us as patients own, is our diet, exercise, and weight loss, and how they impact diabetes. And then you want to know the signs of improvement in the case of diabetes: checking your A1C, checking your kidney function, your foot exams, your eye exams, your cholesterol. So those are all things that you want to know. What are the numbers we're looking for, doc? And I want to make sure I get those in good control. So a good number for your A1C, if there's anyone in the audience with diabetes, you want it less than 7 for the most part for every patient, because that reduces your risk for complications of diabetes. And then knowing how the lifestyle impacts your disease. So, you know, my carb intake, do I eat too many tortillas or chips or rice or pasta? How much exercise do I need to get, doc? How much weight do I need to lose? And what's my actual weight target? Stress management and mood, those are also key. So, so this is all about putting knowledge in your brain, because that's going to impact how your disease functions and how successful you are at partnering with your doctor and controlling it. Stress and mood management, I talked about this. This is either the stress excuse, which allows you to sort of bail and not participate and maybe not take your medication and maybe not deal with the diet and exercise and weight loss. So if you're sensing you're in zone 3 or zone 4, know that it's not just an isolated thing. It's actually going to bleed over and affect how you approach a lot of things in your life, decision making, and your health as well. And know that there's also a spiritual influence on the disease process. Okay, so that's one example. So how do you visit the doctor? I highly recommend that you go with your spouse or a trusted person. And some of you may be saying, the last person I want is the person who knows exactly what I do and how little I do of what the doctor tells me to do. I don't want that person sitting next to me when I'm talking to the doctor. So it turns out it's really helpful, because we can cut through all that and get to the bottom line. And the other side of it is that that person who cares about you is going to be listening to things that you may not be listening to. And they have a perspective that you may not have as you're sitting there with the person, with the disease, talking to the doctor. And so in my experience over decades of treating patients, that's one of the most valuable things you can do, is have someone you love and cares about you come with you to the doctor and kind of be there as your advocate. The other thing I want you to consider doing is go to take notes. Be prepared, or have your trusted person write down your questions, write down your concerns, talk about these things before you go to see the doctor, because once you get there, the doctor's going to have a whole lot of things to do. Remember, it takes 27 hours per day to get all the work done. So I have all these lists of things I need to get through. And so I want to make sure I also hear what you have to say and what your concern is. And if you've thought about it a little bit ahead of time, maybe discussed it with your spouse or your trusted person, then you'll be ready to ask those questions. And I'll see the paper in your hand, and we can kind of make sure we address that. And also, don't be afraid to ask the doctor, I don't understand exactly what you're saying. Can you say it in a different way? We've gone to school, we've learned this information from a technical point of view, but it's most important to translate that into some a language that you understand and you feel comfortable with. It's your body, it's your condition. You have to make decisions about it, so you have to understand it. So don't be afraid to stop and ask your doctor to explain it in a different way. If your doctor gets upset, or they storm out, or they say, I don't have time for this, you may not have the right doctor. So, and again, leave with specific instructions. Your doctor really wants you to be doing a certain thing, or lists of things, and it's their responsibility, my responsibility, to list them for you. What do I specifically want you to do? You're not exercising. I want you to, let's try 10 minutes of walking a day until I see you next time in 2 weeks or 2 months. Or you're doing 20 minutes a day, your weight's come down a little bit, let's bump it up to 30 minutes per day. So that's a very specific thing that I want you to do, because I've talked to you, you know what you're trying to accomplish, the medicine that you're taking, and how your lifestyle is going to improve your health. So make us list it for you, or take the notes yourself, either way. And then finally, you really have to commit to the plan. You walk into the doctor's office committing to hearing the truth about what's going on. How's my health? How am I progressing? Are there some gaps? And then when you hear those gaps, you need to do A, B, and C, commit to doing those things. And two other parts to this that are related, talk about it with someone. So this trusted person has sat there, they've heard it, they've heard what you're supposed to do, and now they can be your accountability partner. So when you grab that donut and you have diabetes, the person's going to look at you, they're going to cut you a side eye, and you may be more likely to put that donut down and maybe have some broccoli instead. So one other thing is really helpful. Brain science shows that you could hear amazing information that you totally agree with, but if you leave and don't do anything about it immediately, you're less likely to follow through in the future. So anytime you hear something that's impactful, it could be about health and wellness, it could be about finance, do something about it immediately, the same day. Take immediate action, because that's going to lock it in and make it more likely to become part of your routine. And now we'll transition to talking about these building blocks. So you're building this foundation of healthy habits. So you do these really simple things done consistently over time. And if you think about a lot of people thinking about health, they say, okay, I got to get healthy. So I'm going to go to the gym and I have this long list of exercises, or I got to do spin class and something complex. So anything complex will get done occasionally. But if you simplify it just right, then you'll be able to repeat it consistently over time. So sometimes we don't start our exercise or our diet changes because we've made it too complex, and we want to simplify it so we can repeat it consistently over time. And then you take it to the next level by really understanding, wow, yeah, my body, my mind, my emotions, my spirit, they're really all one thing, and they're connected. They all influence each other. So if my body is suffering, I can do things with my mind and my emotions and my spirit to actually impact that. And also, obviously, going to the doctor and taking my meds and changing my lifestyle. So you've taken it to that next level. And then you're also going to be taking an active role in disease prevention, understanding your disease process, using your doctor, your paid consultant to explain these things to you in a way that you understand and you're comfortable with. And treating your medical conditions from a point of knowledge and not just passivity. Unfortunately, medicine 50 or 100 years ago was very paternalistic and controlling. And I tell you, you need this, and you can take it or leave it, and I don't have to explain anything to you. But that's not really how medicine should function. You really need to have a collaborative relationship with your doctor who can explain things and is sensitive to who you are individually. And then we make this shift. So you built this foundation, you're thinking about a building that you're building step by step. And now you want to think about, well, how do you pass on this legacy? I've really focused on it personally, but now you have to think about, what do I do with my family? What do I do with those family events that we so love in our community that have sometimes contained a lot of unhealthy eating? Do we have to disrupt that whole thing? By no means. We can do the same kind of events, but change the health, change the nutrition, change the menu a little bit. So you can still have that closeness, still have that joy, and still have the taste that you enjoy just by tweaking a few things and making those items a little more healthy. So thinking about passing a legacy, you want to think about those cultural celebrations, those commemorations, and the family time that you spend focusing on cultivating a healthy body, mind, emotions, and spirit. And we're going to wrap up. This is the last slide. So get educated, know your body, all the domains, and how they interact with each other, and how you can use each domain to affect and improve the health and wellness of the other domains. Consult your doctors, take notes, take a buddy, and follow through. practice those daily healthy building blocks alone and in community, and transform our cultural celebrations into healthier ones. And that is what I have for today. Thank you so much for your time, and we will now pass it over to our Q&A session.
Reverend Gerald.
Thank you. Really appreciate that, Dr. Williams. That was a very thorough presentation. And I like what you said about if you don't react immediately, you have a tendency to let things go. So with what you and Dr. Williamson have presented this evening, I'm hoping that there are questions in the minds of those of you who are with us, and you won't be bashful about sharing them. So we're going to turn it over to Jacinda Moten, who is a virtual producer, so she can get some of your questions answered. And I have a couple, but we want to get to yours first. So if you have a question, please put them in the chat or Q&A, and Jacinda will make sure that they get answered. Jacinda?
All righty. Let me bring back our speakers. Have them back. Okay, so our first question is for Dr. Williamson. What would you say is a great way to deal with stress immediately leading into moments of performance? Example, public speaking nerves.
Great question. So most people obviously do encounter public speaking, a fear that many people do share. One thing that's helpful, I would say with that, there is a good, robust line of clinical research that says if you can actually get very practiced at recognizing where in the body you actually are experiencing the tension, the stress, the fear, the anxiety, and get as specific as possible. Do you feel it in your throat? Does it feel like butterflies? Does it feel like something squirming in the stomach? And rate that on a scale of 1 to 10. If you can start to do those things in those moments, and it does take practice, people who can basically do that and then engage a process of breathing a bit differently, it does bring down the anxiety. And all of those things do work together. And so I would say understand this about it. When you actually now are focusing in on trying to understand what the stress feels like, where in the body, really trying to get specific with it, you are basically adopting a new position relative to the fear. The illustration would be if you're a sailboat on the lake and the big gust of wind comes along and you got the sail up, it's going to blow you and dictate wherever you go. But if you can lower the sail, here comes the big gust of wind, and you now get a sense for, well, the wind is pretty strong, maybe it's at 13 knots. It's pretty cold, maybe it's 50 degrees. Now you're examining things. And when you get into that sort of a headspace, that's your brain functioning from the prefrontal cortex, your decision maker now is involved, not just the reactive part of the brain where the fear is. Now you have a much better chance of navigating that situation differently and more effectively, and the fear and the reactivity doesn't take over. You've lowered the sail in the midst of the storm. It's something that takes quite a bit of practice to do, so you can't sort of pull it out your pocket if you've never tried it. But mindfulness that you can practice 2-3 minutes a day, lots of exercises online can walk people through that. You develop the capacity to do that. So typically that's pretty effective in the face of anxiety.
I would also add, I mean, sometimes it's just the simple things too. I mean, I think slow, deep breathing. I mean, one of the things that happens when you're feeling stress is you have this physical response to it. Your heart rate goes up, your hands get sweaty, maybe your throat tightens, you start breathing more shallow. So one simple thing you can do is recognize those symptoms. And if you can, it just takes a couple of minutes, just very exaggeratedly slow and deep breathing. So and you really just you'd be surprised if you feel that right now. You're like, I gotta get off this thing because I have so many things to do. Take a very deep, exaggerated, and slow breath. It only takes a couple of minutes to do it, and you'll automatically start feeling a little bit of ease to some of those physical symptoms of that anxiety. So yeah, that's one of the things I recommend too.
Awesome. Our next question is for Dr. Derek Williams. What if the physician prescribes a drug that potentially causes weight gain and they say there are no other options? They said, I understand when you said it, it's a risk benefit issue.
Yeah, so no combination of medicine or treatment is without consequence. And yeah, that's one of them. So for example, if you take the treatment of depression, many medications that we use that are very highly effective for certain types of depression sometimes will cause some level of weight gain. And so what you're trying to do is hold those two things in your mind. So the risk of uncontrolled depression, if there's no other options, and the risk of a slight weight gain, yeah, you try to work with clarifying the risk benefit ratio for it. If there truly aren't other options, then you're kind of stuck in a way. I mean, if you stop the medicine, then that condition goes out of control and that risk goes up. If you continue the medicine, you gain a little weight. And hopefully, you'll keep looking and following up with a doc and searching for other options, because at some point in this phase of medicine, things change very quickly. There are a lot of options out there. And then, of course, the weight gain can be counteracted by those lifestyle measures. So really focusing on a mostly plant-based diet, doing the cardio daily, reducing fatty foods and processed foods. So being much more diligent about the lifestyle side can counteract some of those side effects as well.
Thank you. Thank you. Oh, this is a great question for both of you all, since you all are family men. For the men who want to go into fix-it mode, when the wife or girlfriend just wants to vent, what would you suggest on how you listen well without jumping in?
Yeah, we're both perfect at this. So I don't know which one of us should go on the chopping block first.
Right. Yes.
Yeah, I think someone put in the chat earlier, what was the phrase? He said about listening. Yeah, you got to have some very intense power there it is, power listening. So I think listening to yourself and listening to the other person before you speak. So be quick to hear, slow to speak, and slow to anger. Really helps you frame what's most important at that moment. Because if you're, and to steal Dr. Williamson's terminology, if you're in reactive mode, you are in trouble, because you're going to react to everything. You're not going to really be listening or being empathetic to the other person's concerns. And then you're going to actually shift the conversation from the real issue, which if you dealt with that would be resolved, but now it's your attitude. And so now you've become the problem instead of what the problem really is. And so it takes, praise the Lord, some spirit. That's where that spiritual box comes in. Lord, help me slow down and listen.
Yes, absolutely. I would add to that too. That's a great question, because I would just encourage us to also consider, oftentimes we're looking for what do we do in the moment in order to avoid or prevent. And I would say, let's take a step back. Typically, these are patterns. We get into patterns and habits with our partners and spouses. And that's what we have to recognize. And those patterns and habits aren't usually broken by just declaring once and for all, I'm going to be different. Patterns and habits are broken by consistently reinforcing a new pattern. And so typically we recognize, I've fallen into the old pattern after we've fallen into the pattern, but we have to actually recognize it. So we might fail. Okay, we're in that old pattern and habit again, we're frustrated. But if we make a mental note, I'm in the pattern again, you're recognizing it. So the next time it happens, you might catch that pattern. Instead of 5 minutes after being in it, maybe you catch it 2 minutes after being in it. But if you consistently reinforce catching yourself, you will eventually catch yourself before you embark on the pattern. Now you've got the choice. Am I going to go left or right? From the therapist's perspective, once you have the choice, now it's just not automatically going into the pattern. That's the victory. Now, if you choose to go into the pattern, we need to probably sit down and have some more therapy. But you get out of the patterns by setting new patterns. Give yourself some grace because it takes a while to actually develop that capacity.
Yeah, you know, as you're talking, I think of one other thing. Sometimes there's an issue which is relatively small, but then it's attached to that other thing that triggers that pattern. Mm-hmm. And so if we can step back and start with just dealing with the issue. Okay, back up. What's the issue that we're really trying to solve right now? And then we need to be in a different frame of mind to talk about that really big issue. We have to sit down and plan to be in calm-minded, deliberate space, maybe with a third party to help us negotiate that. But starting with that small thing really helps to also set up a positive thing. Oh, we fixed this small thing. Wow, that is changing the framework a little bit.
Definitely. So just really getting to the root, no sweeping under the rug. All righty. Next question is, what would you all recommend in terms of food, herbs, scents to reduce like cortisol levels?
Mm-hmm. Yeah, so I will say this, that as a country, we are obsessed with turning things into pills. So we will take, now think about this. I was listening to a TV station when this commercial came on for this. I'm not going to name the supplement, but it's basically the bottle. There are two bottles and it's just all fruits and vegetables. And then they take them off the tree or the bush or the plant. They put them in a processor, they dry them out, they add some other chemicals and they put them in some capsules and then they put them in a bottle and they send them to you. And they're supposed to make these amazing changes in your body. And my question is, well, why wouldn't you go all the way back to the beginning and eat that stuff yourself? It's much healthier. There's no additional chemicals, no processing. And, you know, during the pandemic, people said, well, I'm not taking that shot because you don't know what's in it. I say, you don't know what's in anything you eat. So it's best to eat the most natural whole food you can and the less processed you can, because yeah, you don't know what you read those chemicals. If you can't pronounce it on the ingredients list, there's a problem. So, so I would say as far as herbs go, in general, it's best to have a well-balanced, mostly plant-based diet because you're going to get all those fruits and vegetables. And then as far as herbs go, yeah, I think there are some beneficial effects to using herbs to supplement that base of healthy nutrition, but they're not magical. So they don't replace, like, say, blood pressure medicine or medicine for your diabetes, but they can be used as adjuncts to good health.
Yeah. Yes, I would only add, if one is trying to reduce cortisol, it's more to understand cortisol is there because when your body encounters demand, it has sort of one way to respond. Cortisol happens so that you can, if there's a threat, you run, you fight, you live to see another day. Cortisol gives the muscles that energy to do that, along with a number of other chemical changes. That cortisol there is to put your body in fight-flight mode if it needs to be, even if it's small stressors. That's the body's sort of hardwired response. So in order to keep cortisol from getting too high, mimic that fight-flight response. And so when we're talking about exercise, walking, using the arms and legs cardiovascularly, it's going to mimic that process, and that's what lowers the cortisol, which thus speaks to the importance of having sort of a regular routine of enough physical engagement and exercise. And I agree with the good doc in terms of people always set these really extreme goals. I'm going to run a marathon for the rest of my life. Don't do that. That's going to psych yourself out. Nobody runs the marathon by saying, I'm going to run 26 miles today. They say, I'm going to run to that tree. When I get to that tree, if I got some energy, I'm going to run to the next tree, right? You set realistic goals that you can sustain, and you just want to make it a part of your lifestyle.
Yeah, thanks for making that point. Yeah, cortisol. So diet definitely doesn't directly reduce your cortisol levels, really only consistent cardio exercise over time. And the goal is to get at least 150 minutes. But if you're in a high stress mode, you may need to do 30 minutes a day for two reasons. One is to reduce those cortisol levels, but also you need a break from your brain processing. So you're in this high stress mode. You have multiple things on your mind. Your mind's like a popcorn popper, just thinking about things all day long. And so you need to step out of that work mode, step away from the computer, put the device away. And you go for a 30-minute walk, you're decompressing your brain and giving you a space to also relax and reduce that cortisol level.
Awesome. Well, thank you, gentlemen, so much for your information, your insight. I'm sure our community really, really will greatly benefit from it. We can't see each other, so we're going to give you all some virtual hands. Thank you all for your time. And I will turn it over to Reverend Gerald.
I want to thank everybody for being with us tonight. The only problem I have with tonight's presentation is that 1,000 people didn't see it. But the good news is all your friends and family can see it. If they go to laul.org/BWARP, probably by the middle of next week, this presentation will be on the website along with all the other BWARP series that we've done over the last 2+ years. Is on the Urban League's website for you to view and get this great information. I want to thank Dr. Williams and Dr. Williamson for their expertise, and I hope all of you realize that what you got tonight, if we had to put a time value on it, is invaluable. And I especially want to thank the person that makes this thing really happen, Mr. Cinda Moden, who's been our virtual producer for this event since its inception. And Jacinda, we really appreciate you keeping us all organized and on point and making sure that everybody gets this information. So please tell all your friends and family about the BWARP presentations and where they can find them. And I also encourage you to log on to parksideedc.org to learn more about Parkside's organization. And Dr. Williams and Dr. Williamson, please put your information in the chat for people who want to reach you and get in contact with you can do so. So we're going to have some closing remarks from the Urban League, starting with our Director of Economic Development, Mr. Daniel Leathers, and then you're going to hear from President and CEO, Mr. Michael Lawson.
So good evening, everyone. As the good pastor mentioned, my name is Daniel Leathers with the Los Angeles Urban League. Some of the good notes that I took down was that we need to make sure that we get into zone 2. And if we have difficulty making seemingly easy decisions, that means that we're stressed out. And then also learned when you're speaking with your doctor, similar to what you would do when you have your check-in with your financial advisor, always leave with a plan. So you don't want to just leave and, say, hey, good to see you, talk about the Lakers and roll out. You need to have a plan for what you're going to do for the next meeting. So thank you, gentlemen, for sharing all that information. And so segueing into what we are engaged in at the Urban League is, if there are any entrepreneurs, either existing entrepreneurs or budding entrepreneurs, one of the things that you must do to be successful as an entrepreneur is maintain your mental and physical health. So glad to see everyone on this session. And within the Urban League, we have an entrepreneurial center, and you can obtain information on that at laul.org/programs/entrepreneurship. And we invite you to become a client where we have a small business administration navigator program going on right now. We also offer one-on-one coaching where we have expert consultants that will work with you one-on-one to discuss the issues facing your business. And we also have various grants that come available throughout the year for Entrepreneurship Center clients. So please join, and we look forward to working with you. And then at this point, I'm going to pass the floor on to our president, Mr. Lawson, please.
Oh, thank you very much. This was a wonderful, wonderful presentation this evening. My name is Ambassador Michael Lawson. I'm the president and CEO of the Los Angeles Urban League. And tonight, we come to the end of another fantastic series regarding a successful story that is important to Black wealth attainment. This was about health. But you have to understand that if you don't have your help, the wealth doesn't make a difference. So this is one of the most important things that we have to look out for ourselves and for our families. I want to thank Dr. Williamson and Dr. Williams for their outstanding presentations. And I also want to thank Reverend Gerald Smith, chairman of the Parkside Economic Development Corporation, for his leadership in presenting BWARP, and Jacinda Moulton for her continued support producing BWARP. Also want to give a shout out to our Chief Operating Officer, Ms. Cynthia Mitchell-Hurd. She must be commended for her encouragement and support of the BWARP web series. And thank you, Samira, as well, for managing BWARP this evening. Please continue to check our website, laul.org, for the information that was just described to you earlier. And we, again, thank you for your attention and for attending tonight's BWARP webinar. And I look forward to seeing you in the next series of BWARP presentations. Thank you so much.
Good night, everyone. Thank you for your time.
Thank you all very much.